Now the important symptom in this, again if the child is younger, it can happen in 6-month-old, 1-year-old also, is they will cry. And earlier I have seen roundworm bolus, these worms form a big bolus. And I have, from a 2-year-old child or 1-year-old child, I have removed a full bucket full of worms.
You are watching Surgery Simplified, shastrakalasaralshabdomein.
Hello everyone, Namaste. Welcome back to our channel, Surgery Simplified, shastrakalasaralshabdomein. Welcome back, Dr. Nikhil.
Thank you, Namaste.
तो पिछले कुछ एपिसोड में हम काफ़ी टेक्निकल चीज़ें बात कर रहे थे एंड दिस एपिसोड हैज़ बीन ऑल अबाउट द एब्डोमिनल कंडीशंस एंड स्टफ. तो आज कुछ और कंडीशंस के बारे में बात करने वाले हैं.
हाँ, तो फर्स्ट ऑफ ऑल अबाउट द टेक्निकल थिंग, these are very technical. I cannot simplify it more than this because they are very, very technical. However, I think I have succeeded in trying to convey what I want to.
Yes, definitely.
So today we are going to talk of intestinal obstruction. In other words, जब आंतड़ी बंद हो जाती. Now you know that from the mouth to the anus, the entire alimentary system is one long tube. Okay, so you have the mouth, then you have the pharynx, then you have the food pipe which is called the esophagus, then you have the stomach, then you have the duodenum, then you have the ileum and jejunum which is small intestine, then you have the cecum, colon, then you have the rectum and the anus, and then at the junction of the ileum and the cecum you have the appendix. This is one long tube. Okay, I am going to divide intestinal obstruction into two parts. Intestinal obstruction that happens in adults and intestinal obstruction that happens in children. One of the common surgical emergencies which happen in newborn children or very small children, which is called neonates. Neonates means first 1 month of life.
Okay.
Or infants, which is first 1 year of life. Okay, are generally having a cause in a congenital problem. That means a problem which is there since birth. And because of that they develop obstruction. So when the intestine is being developed inside the fetus, it undergoes a certain type of rotation. Because it is a single tube, then it becomes a curved tube and then it rotates around the vertical axis. Okay, it rotates around the vertical axis, so that some part of the intestine is on the right side, some part of the intestine is on the left side, again on the right side, again on the left side. There are fixed points. Like where the stomach starts from the duodenum, it goes up. There's where the third and the fourth part of duodenum starts at the jejunum. There's a fixed point there. Then again down towards the ileocecal junction, there's a fixed point, and so on. Now, if the rotation does not happen as it should be, around the 360 degrees around the vertical axis, it rotates in a particular way. But either the rotation doesn't happen completely, or it happens in the opposite direction. We call it malrotation. When there is malrotation in a child which is born, there are certain conditions which happen along with that. Certain bands are there, bands which can cause the intestine to get blocked or the intestine to rotate and become a volvulus. That means a knot. कि आंतड़ी के एक knot हो जाती है, मतलब knot, what do you call knot in Hindi?
गांठ हो जाता है.
गांठ हो जाती है, तो आंतड़ी की गांठ हो जाती है. So small child cannot tell कि it has got pain.
Correct.
All it will do is cry. Now the important thing here, which is the take home message, any vomiting which is yellow in color should be taken to hospital. If child is vomiting also, you take to the hospital. But if the vomit is only food, milk पिया, milk बाहर आ गया, it is not so serious. But any vomiting which is bilious, which means yellow in color, is generally indication of some bigger problem. Now, what is important in this is, do not wait, because in children, unlike in adults, the surface area of the child is much more, so they tend to perspire more, and their fluid requirement is very less in the body. In the sense, you give little fluid, they'll be okay, but if they lose little fluid also, they'll be not okay. So if they vomit 1 or 2 times, they can go into dehydration immediately and then start losing consciousness. So you need to take the child immediately to a pediatric surgeon, or any place where there is a pediatric surgeon available, or any surgical hospital where they can call a pediatric surgeon to assess the child whether the child needs surgery or not. Okay. So malrotation with volvulus is a common condition in very young children. Then slightly older children, between school going age and this, there is a condition known as intussusception. What does this mean? Intestine is like this, one loop telescopes into the other, like this, and then somewhere it goes and stops. You know, it's like one pipe going inside another pipe. That is called intussusception. Now this typically happens between 2 years to 9-10 years of age. Now the important symptom in this, again if the child is younger, it can happen in 6-month-old, 1-year-old also, is they will cry. They will just put their feet up and cry. But stools में थोड़ा blood आएगा. जैसे वहाँ पे bilious vomiting आता है, यहाँ पे stools में खून आएगा. If there is blood in the stools and the child is crying every time, you must take to the hospital to find out whether the child has got obstruction. If the child is crying as bilious vomiting, take to the hospital to find out obstruction. These are 2 common conditions. And earlier I have seen roundworm bolus, you know, these worms form a big bolus. And I have, from a 2-year-old child or 1-year-old child, I have removed a full bucket full of worms.
Okay.
Big worms. So they form a bolus, you know, they get coiled against each other and form a bolus and block the intestine. That's another common condition which I had seen in villages, in villager patients in the beginning of my practice. But I think because of better hygiene and anti-worm medicine being available readily, and most pediatricians giving this medicine, I haven't seen it for a long time now. So these are 2 or 3 conditions. Of course, the diagnosis is simple. You take an X-ray, you can see the obstruction, and the child generally needs surgery to relieve the problem. Okay. Now coming to adults. In adults, the commonest condition is intestinal obstruction after surgery. Now I told you, if you remember, that if the appendix bursts, I said it can cause problem. So one of the problems which whenever, even people who have burst hole in the intestine and peritonitis, whenever there is peritonitis, that means same thing happens. When an appendix also bursts, they will have peritonitis. Peritoneum means the sac-like which covers all the intestines.
Right.
So when that is soiled, it heals with scarring. It will scar. When you take an incision, you will put a scar.
Correct.
So even if they heal and they come out, there will be scarring. So intestines get stuck to each other. And because of that, there is a fixed point around which volvulus can happen. So post-operative adhesions, we call it adhesions, which is scar tissue, which causes twisting of the intestine, is a common condition in adults. Any kind of surgery, even plant surgery you can have, it will go and get attached to the scar. So this kind of condition can lead to obstruction, and then we sometimes have to go in and again operate and relieve the obstruction. Okay. Then the other common condition is malignancy.
I've heard about the term, but not sure.
Cancer. Cancer of the large intestine can appear as obstruction. Okay, so that's another condition, especially little elderly people. So they get obstruction because of that. And again the same thing, there is one condition called as volvulus or twisting of the intestine without operation, primarily, just like that. And in our country, tuberculosis is a very common condition. So if the patient has tuberculosis affecting the intestine and you give them anti-tuberculous drugs, when the intestine heals, it forms scar tissue. After the treatment is over, then they develop sometimes obstruction. So post-op adhesions, this after surgery, primary volvulus, that means without any surgery, also it can go into twisting, tuberculosis and cancer. These are the conditions in adults which lead to obstruction. All these conditions need admission, ICU treatment, plain X-ray erect which will show that the intestine is blocked, maybe a CT scan, and most likely emergency surgery. Most of the times you will end up with emergency surgery. Okay, so the take home message again is that if you are getting recurrent abdominal pain in the abdomen along with a sound,
अंदर पेट
yes, जैसे आपको जब भूख लगती है तो आवाज आती है ना, the same kind of sound will come, and sometimes you can actually see the intestine moving across the abdomen. You can see it because it is trying to overcome the obstruction. It's called visible peristalsis. Peristalsis means normal movement of the intestine. Okay, it's about 8 to 10 movements per minute. Okay, so that becomes hyper. You get hyper peristalsis and it becomes prominent. So you can actually see the intestine moving on the abdominal wall when you actually examine the patient. So any symptom like that, and of course vomiting. Patient, if the obstruction in the upper part of the intestine, small intestine, they'll have more vomiting. Lower part of the intestine, they'll have constipation. They'll say we have not passed stools, we have not passed flatus. You know, lower part of the intestine, large intestine, like cancer of the colon and all, either they'll have, it's called obstipation. Constipation is passing hard stools or difficulty. Obstipation means no flatus, no gas, no feces. So they have obstipation, they generally have pain, okay, and sometimes they'll have blood in the stools if it is cancer. In small intestine obstruction, you'll have vomiting. Upper intestine, you'll have vomiting.
Okay.
Especially bilious vomiting. So these symptoms, whenever there is abdominal pain with vomiting, especially if it is yellow vomiting, always, even if it is in an adult or definitely in a child, you must take for assessment to the nearest surgical hospital which is equipped with a good operation theatre and a good surgical ICU and have access to a pediatric surgeon, cancer surgeon, general surgeon.
Okay, nice. Another very informative video for all you viewers out there. So this was all about abdomen obstruction.
Intestinal obstruction.
Intestinal obstruction, yes. So आपके पास अगर कोई भी queries है और if you may be facing or bearing some pain and अगर आपको कुछ clarify करना है तो you can put that on comment section and don't forget to consult your doctor immediately. And अगर आपको वीडियो पसंद आया तो please hit that like button, subscribe to our channel and hit that bell icon for subscription and stay tuned for more informative videos. Thank you.